for joining us for the COVID-19 media call for October 29th. We'll start today's call with comments from Health Commissioner Jan Malcolm and MDH Infectious Disease Director Chris Earsman. We'll then open up for questions from reporters on the line. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. Well, just since yesterday, we have an additional 79,000 cases of COVID-19 confirmed in the United States, and an additional 975 Americans have died. So we're now at 8.8 million cases in the U.S. and 227,000 fatalities from COVID-19. Here in Minnesota, we are reporting today an increase of 2,872 additional laboratory certified cases since yesterday. This is on a testing volume of just under 27,800 tests. Obviously, this new case total eclipses the record that we just set last week for 2,300 cases in a day. We also had an additional 42 people in the hospital, bringing the hospitalization total to 685, which also is a high watermark. 168 persons are in the ICU, which is not the largest number of ICU patients that we've seen. Sadly, we also had 32 additional deaths reported yesterday across 18 counties, 14 of them in the metro area, 18 of them in greater Minnesota. These deaths include 20 residents of long-term care facilities, and the ages range from people in their 50s all the way up to the 100s. As I mentioned, today's case count, the reported today, came in yesterday, is by far our highest single day increase in cases, but the way things are going, I'm sorry to say that I don't think that record's going to hold for very long. This is now our fourth day this month with more than 2,000 cases, so it appears that 2,000 and more is becoming our new norm, and I think we need to brace ourselves for days with bigger totals yet to come. The weekly change in cases continues to grow. We're at 11.1% increase in cases versus a week ago, which is up over 1.5 points from just a week prior. The weekly change in testing continues to grow as well at a steady rate of about 7.2% during this week. The 7-day average testing positivity rate has gone up again to now 6.8%. And this is with the 1-week lag factor that we keep talking about. And we know that test positivity rate is going to go higher in the coming days. As I mentioned just yesterday, the growth that we're seeing isn't just caused by one or two big events. It's driven by literally thousands of seemingly small decisions people are making every day without realizing the full impact those decisions are having on their families, their neighbors, and their community. We're seeing that these small everyday gatherings and activities are leading to infections that are then spreading into long-term care facilities, hospitals, schools, school sports, businesses, and more. I know so many Minnesotans are trying to find the right balance between the need for social connections and COVID-19 precautions. But the level of virus that's out there now means that the very things we were doing a couple of months ago that were less risky then, with less disease circulating in the community, are riskier now. And we just keep urging people to step up their efforts to follow the guidelines for social distancing, wearing masks, avoiding large gatherings, and staying home when sick and seeking testing. With that, I will pass it to Chris Earsman.
Thank you, Commissioner. I want to talk about community transmission, long-term care, and a recently released MMWR article. Minnesota sadly appears to be approaching the kind of explosive growth we've seen in neighboring states, and that places great pressure on all our systems and people, from contact tracers to data teams to healthcare workers, hospitals, schools, businesses, and particularly long-term care facilities. We're working on an update report for the governor's 5-point plan to help long-term care facilities, and we look to share that soon. In the meantime, it's important to be clear about what's happening and what we can expect to happen in the near future with long-term care facilities, given the dramatic growth in cases we are seeing. Long-term care facilities with support of state and local government have done some really impressive work to build up the COVID-19 safeguards, bolstering infection control plans, setting up staffing support processes, and ensuring adequate supplies of personal protective equipment. This work helps keep case growth in long-term facilities slower than the growth in cases in the state as a whole, and help Minnesota rank near the bottom of all states in terms of COVID-19 cases in long-term care settings. This was something White House Advisor Dr. Birx praised us for when she visited last weekend. But that work only gets us so far. We have an incredibly high rate of COVID transmission in our communities, and that places tremendous pressure on the safeguards we put in place to prevent COVID outbreaks in long-term care. This past week, we've seen some alarming numbers, including 186 new cases in long-term care on Tuesday alone. This shows that even with the good work that's taken place, even with the flood walls we've built up, if the waters rise high enough, we'll still have big problems. We need Minnesotans to act now to slow the spread of COVID-19 in their communities, and not just because we want them not to get sick, although we want that too. We want them to act now to slow the spread of COVID so they don't get sick and spread it to a vulnerable person living in a long-term care facility, or spread it to a member of their community who works in a long-term care facility, or spread it to someone that they know who has a connection to someone they don't know who works in long-term care. This issue of protecting our healthcare workers and our long-term care workers in particular is really important. The long-term care industry had workforce challenges long before COVID-19 came around, and the more cases we see in long-term care workers, the worse those workforce challenges get. Earlier today, the CDC published the latest edition of their Morbidity and Mortality Weekly Report, or MMWR, and it includes a submission on COVID-19 in healthcare workers from our epidemiologists at the Minnesota Department of Health. And I really want to acknowledge the great team of EPIs that we have. The timeframe for this report was March through July 2020, during the height of COVID-19 transmission in long-term care facilities in Minnesota, and before the implementation of the governor's 5-point plan. As the article describes, our epidemiologists found that healthcare personnel face a high risk of being exposed to COVID in the workplace, and they face a significant risk in social settings. One of the key findings from this project was that more than a third of high-risk exposures that for these workers occurred outside of direct patient care in their homes and communities. Multiple outbreaks associated with activities outside of work, for example, social gatherings such as birthday parties, weddings, bonfires, led to cases of COVID-19 within healthcare facilities. And when we look at the more recent data since this report was developed, as I said, it was from earlier in the pandemic, we've seen those percentages flip. More recent data show that more than 60% of healthcare worker cases are due to community and household exposure rather than workplace exposure. And compared with other healthcare workers, workers in long-term care settings more often return to work before the end of their quarantine period because of a staffing shortage in 57% of cases. They worked while they were symptomatic in 5% and received a positive test result, 10%, during the 14-day post-exposure monitoring. So there was definitely a difference between our acute care and our long-term care healthcare workers. Just to be clear, in this publication, symptomatic meant workers who are experiencing one or more of the symptoms associated with COVID-19. It does not mean workers who tested positive for COVID-19. However, anyone who is working in a facility when showing any symptoms of COVID could put patients at risk. That's why we strongly urge healthcare workers and their employers to avoid symptomatic workers having contact with patients or residents. MDH, healthcare providers, and others have taken steps since the time period described in this publication to strengthen the protections for healthcare personnel and for those in their care. Governor Walz's 5-point plan included provisions specifically designed to expand testing and support long-term care facilities' needs around staffing and equipment. It is encouraging to see that since the time covered by this report, March through July, data shows significant reduction in the number of long-term care workers who are working while symptomatic. In May, there were 37 who worked while symptomatic. In September, that dropped to 6. Of course, our goal is to get to 0, and we continue to work with facilities and their staff on this. There are several lessons we can draw from the project looking at healthcare workers. One is that our efforts to work with employees and employers on this issue is time well spent. Another lesson is that healthcare workers should be practicing social distancing and masking outside of work and doing everything they can to limit exposures outside of work. After all, the virus doesn't distinguish what you do at work from what you do at home or on your days off. One takeaway for the rest of us is that we need to do what we can to protect our healthcare workers and long-term care workers from getting COVID from us when they're out in the community. More COVID-19 spreading in our communities means greater risk to our healthcare personnel because there are more opportunities for them to be exposed. And while we are all mindful of the supply of hospital beds, all the beds in the world are worthless without skilled, experienced healthcare workers to staff them and to provide care. Similarly, the best protected long-term care facilities and residents would be in very rough shape if a sizable number of their workers got COVID-19 from family or other community contacts. That's why you continue to hear us talk so much about how alarmed we are by the levels of community spread we are seeing. We know how that spread impacts and threatens so many sensitive areas of our society, from hospitals and clinics to nursing homes and assisted living facilities. This is a problem that requires the efforts and attention of each and every Minnesotan. Please do your part and practice social distancing. Wear a mask when in public, avoid larger gatherings, stay home when sick, and get tested when appropriate. Just keep in mind that that phrase, 6 degrees of separation, means that we can be connected to people very remote from us and sometimes with only 6 degrees of separation. And think about the fact that even if you don't think that your activities will impact a healthcare worker, chances are that it's far less than 6 degrees of separation between the people that you know and someone who's serving in the healthcare setting. Thank you. And with that, I'll turn it back to Mike.
Thanks, Chris. Operator, we're ready to take questions. Operator, I believe we're ready to take questions.
Yes, sir. Ladies and gentlemen, as a reminder to ask questions, you will need to press *1 on your telephone. To withdraw your question, press the pound key. Again, ladies and gentlemen, if you want to ask questions, please press *1. Please stand by while we compile the Q&A roster. Your first question comes from the line of Jeremy Olson from Star Tribune. Your line is open.
Yes, hi. Commissioner, you had cited some hospital numbers. I believe those are the epidemiology numbers of Minnesotans who are hospitalized. I wanted to flip and ask about the hospital capacity numbers on the dashboard. It's only because there was a one-day increase, according to the update, from 519 non-ICU patients yesterday to 694 today. And then unless that's a statistical blip or an error, that's 180 more patients hospitalized or reported hospitalized in one day. Do you know much about that jump of a number and what's going on there?
I'm sorry, Jeremy, I do not. Chris, do you happen to know about that other dashboard data?
No, so Jeremy, you're not talking about the number of new admissions. You're talking about like bed capacity?
Yeah, the hospital capacity newly reported on the response dashboard page.
Yep.
I mean, it's still your data, or it seems to be your data, and that's a big jump in numbers. Also, the number of available ICU beds increased, and so I'm wondering if hospitals are flipping more of their backup supply into active beds. So I just wanted you to address both of those things.
Yeah, I mean, we had a really large number of hospitalizations today that were, reporting. So we know that the hospitalization number went way up, and I'm just going to double check from where we are today with where we were yesterday. But I think you're right. I think we went from the high 500s to the high 600s, and so let me just checking on that.
Okay, Chris, thank you. While you're checking that other data source, I think the question was, are hospitals moving into their surge capacity? Was that your question?
Yes.
And yeah, and we have heard reports of that. And I'm thinking probably be a good thing for us to get some of the healthcare surge team on one of these next calls to give you more insight into the difference between these various numbers and trends that we're seeing around the state with capacity.
And Jeremy, I just checked, and we have multiple different sources of data, and what I'm seeing looks like more of an increase of about 60 people. So we can double check on that and get back to you.
Okay. And then, sorry, I had a question to kind of carry the water for my political reporters, but they're asking about, apparently there was a statement that there might be 25,000 people at a rally for President Trump tomorrow. I mean, if you know there's going to be that kind of sizable crowd going in, is the health department or other going to take any steps to try and limit the spread or spread the people out, knowing that's going to be a big number?
Which events are you referring to there, Jeremy?
Let's see. It was just a chief operating officer of McNeilis, the company hosting Trump's rally tomorrow, said he expects a crowd of 25,000. If it's that big, if that's correct, I'm just wondering if knowing that going in compels any sort of response or activity.
Well, I think we have, as we talked about before, a number of communications channels into all campaigns about the gathering limits. Certainly, we can reach out to this host as well. And we have talked before about it's difficult for local officials to take proactive enforcement actions. We just have to keep reinforcing to people what the expectations are. But I will certainly follow up on what you're reporting there, Jeremy. That's the first I'm hearing of that.
Thank you.
Your next question comes from the line of Catherine Richard from Minnesota Public. Your line is open now.
Hi. I was going to ask about that Trump event as well. So I'll just put in my request to get whatever information you have for Jeremy as well on that front. But given the number of high cases you've seen recently, knowing these are lagging indicators, what are you bracing yourself, like numbers-wise, in terms of deaths in a few weeks, hospitalizations? Do you have any specifics on that?
Well, the one thing that we have some line of sight to is just what is happening in the 1 week lag period between now and what some of those statistics that we talk about around the positivity rate, the new case growth rate, and new hospitalization. So we do know that some of those indicators are heading still further up in the coming week. We haven't, I think we've done some various looks at what different levels of case growth translate to in terms of later hospitalizations and ultimately mortality, unfortunately. So we do have some of those kinds of projections. If the growth rate exceeds, we're now over 28 cases per thousand. What happens when you get to 30 and 40 and 50? So we do have some of those projections, and we, as part of why we are urging so strenuously that as a community, we need to do everything we can to try to stabilize these numbers and drive them down from here.
And Commissioner, if I could just add, we certainly have very vivid examples of what's happening in our neighboring states. So in addition to our ability to do some projections on what we think may happen, we look at what's happening across our borders, and that also lets us know what could be happening in Minnesota.
Is there any state in particular that you're looking to right now that seems to be a similar trajectory to the one we're on?
No, but I think that we're looking with concern at where our neighbors have been and the direction that we're going, and there's a little too much overlap between the two.
Okay, thank you.
Your next question comes from the line of Mr. Walker Austin from Minipost. Your line's open.
Hi, all. My question is similar, but I was wondering if the state has done any research or modeling on what impact the new shelter-in-place order or other similar restrictions would have on the course of the pandemic. And if you have any estimates for how many fewer people might die if the state did implement some sort of order like that, similar to the one earlier this year, or if you have any specifics on anything else you might be considering. I'm wondering if, you have any numbers or estimates on possible reductions in deaths if you were to take any of those steps.
We'll be able to give you an update on the University of Minnesota MDH model in the next several weeks. They have continued to work on that model, and one of the things that they are building is the capability to do more simulations of various factors of what would happen if masking compliance went up, for example, or what will happen at various levels of vaccine uptake and efficacy. So we're building a tool that is aimed not for predictions of specific numbers, but directionally kind of the magnitude of impact that some of those mitigation measures can have. I don't have anything that I can share with you today on that front, but certainly we're looking, not only to that University of Minnesota model, but there are a lot of other models all around the country and research happening around some of those questions about how, looking retrospectively, what can we see that the difference is when certain mitigation measures are put in place, and how might you project forward if you were to do more of those same mitigation measures or reinstate some of the measures that you had earlier. And I think we've talked candidly about just the COVID fatigue that's out there, and just concern that unless Minnesotans really understand these risks in very clear and personal terms, just the fact that people are not complying with the current guidance, suggests that just more rules may not gain us more compliance. But that is absolutely something we need to look at and continue to look at what is happening with the current round of mitigation strategies that states are putting in place now.
So to be clear, you don't think new rules would result in any decrease in deaths if they were to be put in place right now?
Oh, no, that certainly wasn't what I meant to imply. Thanks for letting me clarify that. But just that the questions around the impact of mitigation measures just need to be continually refreshed with what we learn, and we're sharing data all the time with folks in other jurisdictions to see kind of what combination of things or what specifics around mitigation measures work. We just keep reinforcing the point that the mitigation measures that are in place right now are evidence-based, and if we can drive compliance up with those social distancing and mask wearing and capacity limit guidances that are already in place, we can make a big difference.
Thank you.
Your next question comes from the line of Chris Megan from Pioneer Press. Sir, your line is open.
Thank you. I wanted to ask a little bit about infections and quarantine among healthcare workers. Do you have any updated statistics on the number of doctors, nurses, healthcare staff that are currently either have had an infection or are currently in quarantine?
Chris, do you have any information on that?
You mean right this minute? We have data that we look at, we interview all healthcare workers and identify if they've had a high risk exposure. And so, we have the data collectively. So for instance, I can tell you that in September, we had 1,039 healthcare workers who fell into the high risk exposure category. That was up from August when we had 1,000. That was up from July when we had 836. That was up from June when we had 703. And then when we go back to May and April, May was 1,362 and April 1,928. And so you can see the definite impact of the interventions that were enacted. But now what's concerning us is that we are starting to see those numbers go back up again. And as I mentioned in my remarks, that is happening not because of exposures in the workplace, but rather because of exposures in the community.
Right, I understand. And so you asked about high-risk exposures. I know that your data table shows about 14,000 infections among healthcare workers over the course of the pandemic. Are you doing anything to sort of measure how the workforce is impacted at any one given moment in time?
Well, that's what I guess I'm getting at, is that we currently work with all the healthcare workers who have had a high risk exposure. And so they are, being interviewed and monitored by our team during the time when they, after their exposure. So yes, we're doing that in real time with the current cases. But that was just a summary of what we've seen over time.
Oh, okay. Is that data available on any of your reports or websites?
No, I can certainly send you those if you weren't writing it down when I said it.
I think I got a couple of them, but if you wouldn't mind, that'd be great.
Sure.
Thank you.
Yeah, I think what's important to note, just a couple of things. One is that the website does acknowledge everyone who's a healthcare worker who's had COVID, but as we've talked about before, not every situation is a work exposure, and as we find with this more in-depth monitoring, many of them, the majority of them now, have to do with exposures that are external from the workplace, and even within the workplace, a number of them are co-workers to co-worker rather than patient or resident to healthcare worker.
Okay, thank you.
Again, ladies and gentlemen, if you want to ask questions, please press *1. Your next question comes from the line of Crystal Booth from KSTP. Your line is open.
Hi, I had two quick questions. My first is, I'm wondering if it's fair to say that the state doesn't feel like it's in control with enforcing some of these rules, because I'm wondering how then the state can handle some of these steps the governor plans to put in place just to control the virus.
Jan, might you be on mute?
Oh, I was. Thank you, Chris. I'm sorry. When the phone goes dark, I forget whether I'm muted or unmuted. I'm not sure I quite got the question clearly. So if you wouldn't mind maybe restating it. I heard you say, do we feel like we're not in control of enforcing the current regulations? And, I think that's what we're seeing, as Chris has described, when we do the case investigations and we interview people and we talk about what were the situations that we were in, we can see that there were, gatherings that are above the recommended limits, and we can see that there wasn't social distancing in the environment and things of that nature. So that's what leads us to say, we know that so many people are working really hard to follow the guidance, but enough people either are unaware of or unconvinced by the importance of the guidance that it is fueling lots and lots of this spread. And it was the second part of your question that I wasn't quite following. I'm sorry.
It's okay. So I was just wondering then how the state would handle rolling out the rest of the 5-step plan if people aren't following these guidelines. Are you considering fines, or what is the plan to do to make sure it's being enforced?
I see. Thank you. So the 5-point plan that we were talking about was specifically around long-term care, and that had to do with really significant ramping up of testing in long-term care, making sure that personal protective equipment was getting to long-term care, which it really wasn't earlier in the pandemic, creating mechanisms to help with emergency staffing, infant staffing shortages. So that the reference to the 5-point plan was a specific long-term care plan. And as Chris referenced, we're just going to be pulling together some data to report on how that's going and some kind of additional next steps that we're planning to take, just given the vulnerability of long-term care in this pandemic. So hopefully that answers your question.
Sorry, so I guess I meant, if that wasn't the right terminology, then for kind of the governor's reopening ideas or even rolling back some of the dialing back terminology that was used. So I'm just wondering if some of the steps to the plan aren't being carried out, I guess, as you're saying, if people aren't following it, what is the state planning on doing to kind of take care of that?
Well, I think that goes to some of the prior questions about what else does the governor need to consider if we can't kind of win compliance with the current guidelines. Might there need to be more restrictions considered, and that is that's a difficult call. I think the governor's been really clear about his preference to keep as much open as possible, and the belief that we can do that if we adhere to the guidance. But he's also said he continues to watch these data and look at the experience of other states and see what other measures might be helpful.
Okay, thank you so much.
Operator, we have time for one more question.
All right. Your next question comes from Michael Gendron from WBio. Your line's open.
Oh, yeah. I know we've seen spikes on other holiday weekends. What concerns do we have going into Halloween weekend? And I guess what Halloween-specific advice would you give to Minnesotans?
Well, I think that was the subject of some of our conversation yesterday on the call, and maybe I'll just ask Chris to repeat a couple of the high points of the guidance about how to avoid higher risk activities. But in general, yes, I think Halloween often is a time when people enjoy going to parties and hanging out with each other, and that falls squarely in the realm of the things that we're encouraging people not to do, or to do very, very, very carefully in this environment. So, Chris, you want to hit just a couple high points of the Halloween guidance?
Sure. And just for your reference, the Centers for Disease Control and Prevention on their website has nice information related to all of our fall and winter holidays. And the way that they have kind of stratified that is it's not a yes or no, do or do not. It really outlines things according to risk, because as we know, unless we stay in our rooms all day, there is some level of risk in all the activities that we're undertaking. And so they have outlined, low risk activities like carving pumpkins with your family, watching a scary movie, that type of thing. Moderate risk would be, doing what they call kind of a one-sided trick-or-treating, where you, as the person who is providing the treat, would put them out on a porch or a driveway, and they're separated so that people could, the kids in their costumes could come by and pick up a treat. That would be considered, moderate risk. And then high-risk activities are obviously identified as indoor parties, gathering in large groups. Going trick-or-treating door to door was listed as a high-risk activity. And we talked about yesterday that while any one of those encounters would be very short, I think that the concern is the multiple encounters and the fact that you're exchanging, an item and things like that. So those are some of the things that that CDC has listed on their website. But it's a very nice outline of looking at different activities you can undertake with a gradation of risk. And then the only other thing that I'd mentioned that we did talk about was that as you are masking to be, in your costume, keep in mind that you should be wearing a cloth mask, so that a Halloween mask is not sufficient. You also need to have a cloth mask as well.
Thank you.
That is all the time we have for today's call. If anybody has any follow-up questions, please feel free to reach out to our communications office this afternoon. Have a good day, and we will be back with you again on Monday.
That was state health leaders with the latest on the COVID-19 pandemic. We'll have more tonight on WCCO4 News at 5 and CBSN Minnesota.
Keep watching CBSN Minnesota for continuing coverage.